Are you or someone you know living with diabetes and searching for a game-changing treatment option? Look no further than Dulaglutide. This revolutionary medication is transforming the lives of individuals with diabetes by providing effective and long-lasting control over blood sugar levels. Dulaglutide, also known by its brand name, is a powerful medication designed to help people with type 2 diabetes manage their condition. By stimulating the release of insulin, reducing glucose production in the liver, and slowing down the absorption of sugar in the gut, Dulaglutide helps improve glycemic control and reduces the risk of complications associated with diabetes. In this comprehensive guide, we dive into the workings of Dulaglutide, its uses, and potential side effects to provide you with all the necessary information to make an informed decision about your diabetes treatment. Say goodbye to the hassle of multiple daily injections or constantly monitoring your blood sugar levels. Discover how Dulaglutide can be a game-changer in the management of diabetes, allowing you to live a healthier and more fulfilling life. What is Dulaglutide and how does it work? Dulaglutide belongs to a class of medications known as GLP-1 receptor agonists. It mimics the action of a hormone called glucagon-like peptide 1, GLP-1, in the body. GLP-1 is produced naturally in the intestines and plays a crucial role in regulating blood sugar levels. When you inject Dulaglutide, it activates GLP-1 receptors in the pancreas, leading to increased insulin release. Insulin is a hormone that helps regulate blood sugar levels by allowing glucose to enter cells and be used as energy. By stimulating the release of insulin, Dulaglutide helps lower blood sugar levels. In addition to its effects on insulin release, Dulaglutide also reduces the production of glucose in the liver. This helps prevent excessive glucose buildup in the bloodstream and further contributes to improved glycemic control. Furthermore, Dulaglutide slows down the emptying of the stomach and reduces the absorption of sugar from the gut. By doing so, it helps prevent sudden spikes in blood sugar levels after meals, promoting more stable glucose control throughout the day. Uses of Dulaglutide in diabetes management. Dulaglutide is primarily used for the management of type 2 diabetes. It can be prescribed as a monotherapy, meaning it is used alone, or in combination with other diabetes medications such as metformin or insulin. The goal of using Dulaglutide is to achieve and maintain optimal blood sugar control. By keeping blood sugar levels within a target range, individuals with diabetes can reduce the risk of long-term complications such as heart disease, kidney damage, and nerve damage. In addition to its blood sugar lowering effects, Dulaglutide has also been shown to promote weight loss in some individuals. This can be particularly beneficial for individuals with type 2 diabetes who are overweight or obese, as weight loss can further improve glycemic control and reduce the risk of complications. It's important to note that Dulaglutide is not recommended for the treatment of type 1 diabetes or diabetic ketoacidosis. It is specifically designed for individuals with type 2 diabetes who have not achieved adequate blood sugar control with diet and exercise alone. Effectiveness of Dulaglutide in controlling blood sugar levels. Numerous clinical trials have demonstrated the effectiveness of Dulaglutide in controlling blood sugar levels in individuals with type 2 diabetes. In a study published in the New England Journal of Medicine, researchers compared the effects of Dulaglutide to placebo in over 9,000 patients with type 2 diabetes. The study found that Dulaglutide significantly reduced hemoglobin A1C levels, a measure of average blood sugar control over a period of time, compared to placebo. Additionally, more patients in the Dulaglutide group achieved the recommended target A1C levels compared to the placebo group. Another study published in Diabetes Care compared Dulaglutide to exenatide, another GLP-1 receptor agonist, in individuals with type 2 diabetes. The study found that Dulaglutide was more effective at reducing A1C levels and promoting weight loss compared to exenatide. Overall, these studies and others have consistently shown that Dulaglutide is an effective treatment option for individuals with type 2 diabetes, providing significant improvements in blood sugar control and weight management. Potential side effects of Dulaglutide. Like any medication, Dulaglutide can cause side effects in some individuals. It's important to be aware of these potential side effects and discuss them with your healthcare provider before starting treatment. Common side effects of Dulaglutide may include nausea, vomiting, diarrhea, and stomach pain. These side effects are usually mild and tend to improve over time as your body adjusts to the medication. If these side effects persist or worsen, it's important to contact your healthcare provider for further guidance. In rare cases, Dulaglutide can cause more serious side effects such as pancreatitis, a condition characterized by inflammation of the pancreas. Symptoms of pancreatitis may include severe abdominal pain, nausea, vomiting, and fever. If you experience these symptoms while taking dulaglutide, it's important to seek immediate medical attention. Other potential side effects of dulaglutide may include thyroid tumors, low blood sugar, hypoglycemia, and allergic reactions. It's important to report any unusual symptoms or reactions to your healthcare provider to ensure appropriate management. How to use dulaglutide, dosage and administration. Dulaglutide is available as a pre-filled pen injection that you can administer yourself. It is typically injected once a week, on the same day each week, at any time of the day, with or without food. Before using dulaglutide, it's important to read the instructions provided with the medication and follow them carefully. If you have any questions or concerns about the administration of dulaglutide, don't hesitate to reach out to your healthcare provider or pharmacist for guidance. The dosage of dulaglutide will depend on various factors such as your individual needs, response to treatment, and other medications you may be taking. Your healthcare provider will determine the appropriate dosage for you and provide instructions on how to administer the medication. Remember to rotate injection sites to prevent skin reactions or lipoatrophy, a loss of fat tissue, at the injection site. Common injection sites include the abdomen, thigh, or upper arm. Be sure to follow proper injection techniques and dispose of used needles and pens in a safe manner. Precautions and considerations when using dulaglutide. Before starting dulaglutide, it's important to inform your healthcare provider about any medical conditions you have, especially if you have a history of pancreatitis, thyroid problems, or kidney problems. Your healthcare provider will evaluate the potential risks and benefits of dulaglutide for your specific situation. It's also important to inform your healthcare provider about any other medications you are taking, including over-the-counter medications, supplements, and herbal remedies. Some medications may interact with dulaglutide and affect its effectiveness or increase the risk of side effects. If you are pregnant, planning to become pregnant, or breastfeeding, it's important to discuss the use of dulaglutide with your healthcare provider. The safety of dulaglutide during pregnancy and breastfeeding has not been established, and alternative treatment options may be considered. Regular monitoring of blood sugar levels and other relevant laboratory tests may be necessary while using dulaglutide. This will help ensure that the medication is effectively controlling your blood sugar and that no adverse effects are occurring. Comparing dulaglutide with other diabetes treatments. Dulaglutide is just one of several treatment options available for individuals with type 2 diabetes. Other medications commonly used in the management of type 2 diabetes include metformin, sulfonylureas, DPP-4 inhibitors, and SGLT2 inhibitors. Each medication has its own unique mechanisms of action, advantages, and potential side effects. The choice of medication will depend on various factors such as individual patient characteristics, preferences, and treatment goals. Compared to some other diabetes medications, dulaglutide has the advantage of being administered once weekly, providing convenience and ease of use. This can be particularly beneficial for individuals who struggle with adherence to daily medication regimens. However, it's important to discuss the pros and cons of each medication with your healthcare provider to determine the most appropriate treatment plan for your specific needs. Patient experiences and success stories with dulaglutide. Many individuals with type 2 diabetes have experienced significant improvements in their blood sugar control and overall well-being with the use of dulaglutide. I've been using dulaglutide for several months now, and it has made a world of difference in my diabetes management. My blood sugar levels are more stable, and I no longer have to worry about constant fluctuations. Plus, the once-weekly injection is so convenient. I highly recommend it. Sarah, 52. I was skeptical about trying another diabetes medication, but my doctor convinced me to give dulaglutide a try. I'm so glad I did. My A1C levels have dropped, and I've even lost some weight. It's definitely a game changer for me. John, 47. These are just a few examples of the positive experiences individuals have had with dulaglutide. However, it's important to remember that everyone's experience may vary, and it's essential to consult with your healthcare provider to determine the most appropriate treatment approach for you. Conclusion: the future of dulaglutide in diabetes treatment. Dulaglutide represents a significant advancement in the management of type 2 diabetes. Its unique mechanism of action, once-weekly dosing, and proven efficacy make it a game-changer for individuals seeking better blood sugar control and improved quality of life. As research continues to uncover new insights into diabetes treatment, it's likely that dulaglutide will play an increasingly important role in the management of type 2 diabetes. Its potential benefits in weight management, cardiovascular health, and overall glycemic control make it a promising option for individuals with diabetes. If you or someone you know is living with type 2 diabetes, consider discussing the potential benefits of dulaglutide with your healthcare provider. Together, you can explore if dulaglutide is the right game changer for your diabetes treatment journey. Thanks for watching.